Government to review restructure Jamaica's disaster preparedness framework. The government will undertake a comprehensive review and restructuring of Jamaica's disaster preparedness and response framework in light of the widespread destruction caused by Hurricane Melissa on October 28. This was disclosed by Minister of Local Government and Community Development Desmond Mackenzie. One lesson Melissa has taught us is that there can be something greater than Melissa, worse than Melissa. So it means that now we have to take a look at our disaster apparatus. That is why the Prime Minister, Dr. Andrew Holness, has done a review of the disaster structure of the country, and we're going to be reshaping and remolding it, Mr. Mackenzie stated. He was speaking during a tour of St. Elizabeth on Saturday, November 1, where he assessed the extent of the damage sustained and oversaw the distribution of relief supports in Black River. Reflecting on the scale of devastation wrought by Hurricane Melissa, Mackenzie underscored the urgency of national recovery and the importance of sustained support for affected communities. I am feeling a sense of loss because we have done a lot over the last 10 years to upgrade local government, especially the facilities. We spent a significant amount of money, especially here in St. Elizabeth. Other parties that have been affected have seen improvement in the last 10 years. So it's a major setback, not just a setback to their operations, but their revenue base have been severely compromised, he noted. The minister emphasized that despite the challenges, the recovery process is actively underway. We are going to be working with all the parishes to ensure that we put something in place that will start to help them. But right now, the important thing is that we're looking at is to get the relief supplies to the people and the cleaning up of the place. That is going to take a massive program, which I am prepared to speak to in this week about what we intend to do. Additionally, in addressing some of the urgent needs of residents, Mackenzie noted housing is the main one because almost 9 out of every 10 is compromised. We're also getting in food supplies now because we're here with the Global Empowerment Mission GEM, and we will be delivering food packages here in St. Elizabeth and in Westmoreland, he noted. Mackenzie reaffirmed that the government's commitment to providing daily assistance to those affected, noting that multiple local and international agencies are actively on the ground, working to ensure that individuals receive essential supplies each day. The government is also placing high priority on addressing the mental and emotional impact of Hurricane Melissa on affected Jamaicans as recovery and relief efforts continue. Mackenzie noted that national-level discussions are underway to provide mental health support for individuals grappling with the psychological effects of the powerful Category 5 cyclone. We're discussing within the National Disaster Council. The Prime Minister did speak about it in a meeting that we had. It is something that is high on the list because there are a lot of Jamaicans, by just the trauma of Melissa, who are experiencing those issues right now. It is not something that is lost on the government, he assured.
This cleanup exercise will include the National Works Agency, TPDCO, the Ministry of Education, and it will be led by the National Solid Waste Management Authority. The purpose of the cleanup, ladies and gentlemen, is for Jamaicans to participate in this national cleanup exercise that will take place right across the country in every community. The Social Development Commission will be responsible for coordinating community activities throughout. And this will be a call for national duty, for national response. The country will require the full support, the full participation of all Jamaicans in this exercise.
400 residential devices provided to Jamaica by Starlink to be distributed to government agencies and NGOs by end of today. The 400 residential devices provided to the country by Starlink will be distributed to the government agencies and non-governmental organizations by the end of today. Starlink is an American-operated satellite internet constellation service. 200 mobile Starlink devices were also donated to Jamaica by charities. Speaking during a press briefing, Telecommunications Minister Darrell Valls said the Jamaica Fire Brigade and the Ministry of Labour and Social Security are among the entities which have already received the residential devices. He said the ministry and NGOs, such as Red Cross, are also using Starlink in their recovery efforts. The minister said members of parliament and mayors, including those in the worst affected parishes, will also receive mobile Starlink devices. Mr. Voss said efforts continue to connect automated teller machines using Starlink. He said the aim is to connect at least 10 in the worst affected parishes by this week. Voss was speaking at the press conference.
The Ministry of Health, in close coordination with United Nations Children's Fund, is working to restore connectivity to major hospitals and community health centers. Jamaican government, the Jamaica Red Cross and international NGOs are also using connectivity provided by Starlink to distribute food, water, and sanitation supplies, basic household items, and children's activity kits. The Starlink devices have been used to establish connectivity for community Wi-Fi points. So remember, we have hundreds of community Wi-Fi sites that were put in by the Universal Service Fund, which falls under my ministry. So we're working with Starlink now to get those back up so that communities, especially remote communities, will have community Wi-Fi to be able to communicate with their families, etc. All the members of parliament in the affected areas will get a mobile Starlink, and obviously the leader of the opposition will get a mobile Starlink, and several others. We only have a few, 33 that we have distributed today, but we're hoping by end of week they will get. So the focus and emphasis is on those hardest hit parishes. Clarification. The mayors in the hardest hit parishes who do not have already Starlink and the municipal corporations will get Starlink to operate as they are the emergency response. Municipal corporation is the emergency response for the parish. I indicate the ATMs. We have gotten lists from the Jamaica Bankers Association. We're working with them through Starlink to connect the ATMs in those affected areas, and we expect to get at least 10 of them up this week. So we are ticking the boxes of all of the essential services that are going to be required.
Primary Care Center mobilized to support post-hurricane health recovery. Minister of Health and Wellness Dr. Christopher Tufton has announced that several primary care facilities will play a critical supporting role in the ongoing post-hurricane recovery efforts across the public health system. These facilities will focus on providing triage and outpatient services to help ease the burden on hospitals in the 5 most severely affected parishes. Speaking during a press briefing at the Health Emergency Operations Center on Knoxworth Boulevard, New Kingston on Saturday, Tufton said many primary health care facilities have already resumed operations, even as repairs and cleanup efforts continue across the sector. As part of the ministry's phased restoration plan, health centers located near hospitals in the 5 most severely affected parishes, St. Elizabeth, Westmoreland, Hanover, St. James, and Trelawney, will initially be used to support trade and emergency services, he stated. This strategic approach will enable hospitals to prioritize emergency cases while maintaining continuity of care for individuals with chronic illnesses and non-critical conditions. An assessment is now being done for these health centers. Where facilities have been damaged, we are restoring them to a level where we can treat non-emergency cases and provide care for people who may be chronically ill or require attention that doesn't need accident and emergency intervention, Tufton explained. He noted that the arrangement is designed to ensure continuity of community health services during the recovery period as hospitals contend with increased patient volume and ongoing infrastructural repairs. In the coming days, we will complete the process so that Jamaicans who need checkups for diabetes, arthritis, and other chronic illnesses can receive attention at a site close enough to the hospital, the minister added. Tufton also assured the public that the ministry, in partnership with the National Health Fund (NHF), is taking steps to ensure that essential medication, particularly for chronic illnesses, are available to those who need them. He further noted that during the ongoing restoration period, select facilities will operate using generator power and store water to maintain essential services until full utility restoration is achieved. It is our intention over the next week to resume activities in all our primary health center facilities and that process has already started. These efforts will continue as we work to restore some normality to community health, Tufton noted. He urged the public to remain informed through official media channels and updates from local health departments as the ministry continues its efforts to restore full operations across all primary care facilities. To subscribe, like, share, and click the notification bell for daily updates.